Good afternoon. And today we have a very special guest, Dr. Brad Gilden. He's a doctor of physical therapy. Good afternoon, Brad.
Good afternoon. Great to be here, Dr. Sokolina.
And thank you very much to our audience. If you have trouble sleeping or sleep next to the snoring partner, this program is going to be for you, because we're going to talk about not very known fact, how physical therapy can significantly help to improve your sleep. And if you're a medical professional who, just like us, very passionate to find all the missing piece of that puzzle called obstructive sleep apnea, this program is going to be for you, because we're going to show you how you can think a little bit outside of the box to help your patients to put all the missing pieces together. First of all, just as usual, I'm going to tell you my story, how I met Dr. Brad Gilden. I met him on a AAPMD meeting on his lecture when he talked about collaboration between dentists, specifically between oral surgeon and orthodontists, and physical therapists, and how a lot of procedures, what we as a dentist do without thinking what actually head is a part of the whole body. As well as medical doctors, they don't think, whole body have a head. So, it's like two different departments. That's for dentists, that's for medicine. But Brad actually brought it together and showed the connection, what can happen if when we think about surgery, we don't think about what that part of the body connect to the rest. Head connect to the spine, teeth actually used for balance, and they have a strong connection with the heels and the toes. We're going to talk about that together. But as a general knowledge, Dr. Gilden, he is in the field for more than 20 years, but I really admire the fact that he's a constant student of science, just like me. He is constantly improve his level of knowledge. He did a lot of courses on the physical therapy, integrative manual therapy and kinesiology. I guess that was kinesiology course, but and functional manual therapy. But two things what really struck me deeply is graduation from PRI Institute, and I'm a big fan of that strategy, as well as myofunctional therapy, and I talk a lot about that as well. And then Brad gonna share with us how he start working with the dentist to help dentists to solve the puzzle. We call it TMJ or TMJ disorder. And he find the connection in the human body. What TMJ might be just a symptom. So my question to you, of course, we all want to know how you become a physical therapist. But for me personally, much more interesting story, how you become physical therapist who not just like a lot of people, but you actually work in a very close collaboration with the dentist and oral surgeon and orthodontist.
Thanks for the great question to start out with. And yeah, it's an interesting story. I would say the first 8 years of practicing physical therapy, I was a very kind of typical physical therapist. I was doing a lot of hands-on work, treating cervical spine, pelvis, treating foot, ankle injuries, knee injuries, the typical things that most PTs see. And then I started treating more cases of concussion, patients coming in with complaints of ringing in the ears, jaw pain. They would complain of sleep-related issues, fatigue issues. And it was a really interesting patient population to start working with because they weren't getting help anywhere else. But I was running into issues related to nighttime. So daytime, we would start helping with getting rid of power function, which is the clenching, the grinding that was driving a lot of the muscular tension that would aggravate all of the neurovascular structures that sit behind the condyle of that mandible. And they would walk out of my office feeling better. Their jaws would be better aligned. The head, cranium, better alignment, less pain. And then they would come back 2 days later saying their pain is back again. And for me, it was, all right, what are you doing at night? And so when they're awake, they can follow through with behavioral changes and they can do exercises. But at night, they kind of lose their ability to control that. And so I had a great fortune of working with a patient. I was helping him with his hip. He had hip mobility issues. And he was a golfer, wanted to improve his golf game. And we got into talking one day. And I said, well, what do you do professionally? And he said, well, actually, I'm a dentist. And my father was a dentist. I don't know if you've heard of him. His name was Harold Gelb. And so this was Michael Gelb, that who I'm sure many of you know is really an expert in treating TMD from the dental side. And we got into talking about the appliance therapy that he's using, that his father really started with the 4-7 position to get that condyle in a better position. And what Michael, Dr. Gelb, kind of took that one step further to say, well, a lot of the clenching was a way to try to stabilize the airway. And so by bringing the jaw into a better position, we're actually creating more tongue space and more airway space, which would now decrease the amount of parafunction that was happening because the body is not as fearful of getting its next breath. And so that was kind of the aha moment for me to say, okay, I've got to get out of my box. I can't just work within the realm of physical therapy because there are other professions out there that can help me manage patients. We can't do it all ourselves. And that was really the birth of integration and collaboration in my mind to start seeking out other professionals to work with. And so I started working with Dr. Gelb 15 years ago, going into his office once a week, and we would evaluate and treat patients together. And I learned so much from him and his staff, and he learned so much about the world of physical therapy and myofunctional therapy as well. And we're both better for it, and we both, are teaching this, as much as we can to our staff as well as to the community and at large when we go to conferences like where you met me at.
Yes. No, I think, like my fascination with your story, it was, from somewhere, from above, what the seeds got on a very good ground, and they actually bloom into, producing you as that specialist. But since not everybody are familiar with the different appliance therapy or what actually physical therapist, first of all, why physical therapists need help of the dentist to stabilize the body. If you can explain that mechanism, and after that, for a lot of my listeners who have no clue about MOOO appliance or MMOO appliance, those code names of appliance would help, and they look like this. I want you to tell a little bit more. So tell me first, what's the philosophy behind your collaboration with the dentist who wants to help? You want to help other areas of the body, and dentists want to address clenching and grinding and maybe temporomandibular joint symptoms, and how you look, or why you think TMJ pain, it's not separate symptom. It's actually a reflection of other areas in the body. Just body trying to compensate with the teeth to find the balance with the teeth. So teeth have a lot of function, but we might not even know at this present science development stage.
Yes, so that's a loaded question that's very packed with a lot of questions within that. So I will try to condense my answer as best as I can. I think one really important thing to understand is that each tooth, the root of the tooth, has a periodontal ligament that is around it, and it has more sensory fibers than the tips of our fingers. We know when there's a little tiny hair in our mouth. That's how sensitive it is. And each tooth in our mouth really has a different function. When we look at the molars, they're for grinding, they're for giving us compression, kind of like the heels in our body, right? When we're walking and we land on our heel, that's compressive, but it tells us when we land that we've just struck ground. And if that ground is stable, we're safe. And so when our molars come into contact, that gives our brain, our midbrain, sensory feedback that, okay, we're stable. We've got a nice bite here. Thinking about the progression of walking as we come over the foot and then push through our toes are directing us. They're allowing us to progress forward. So the heel, we're stabilized. And then as we roll through the foot and push through the toes, now we're moving and directing where we need to go. Well, you can think of those canines and the incisors as guiding us. So now we have bite contact with our molars. And then as the jaw comes forward, that canine tells us, oop, that's as far as you want to go. Now we want to shift back to that molar, just like we want to shift to the other foot. That's how we progress forward, right to left. So if we're missing one of those contact points, our body starts to search for it, and we start to compensate by using muscles improperly to try to get that sensory contact. So one of the benefits of using something like an MOOO, which is a lower mandibular full coverage splint like you showed here, it is designed specifically when we close to give us that molar premolar contact, to give us that ground where our body can go, gives us a little stable. And it helps to stabilize our neck and stabilize our airway. And then when our jaw comes forward to the right, it will give us that canine contact. And that canine contact tells our body, okay, that's the limit that you want to go to the right. Now it's time to shift back to the left side. So just by moving your jaw right and left, if you're relaxed in your body, you should feel your body shift a little bit. And so that's one of the tests that we'll use to see. It's that lateral pterygoid muscle that allows that shift of the jaw to see if they have healthy TMJ functioning to allow for those proper contact points, molar, canine, opposite side molar, and canine. So that's a case where I would use an MOOO splint to allow for that stability. Now, there are some patients that have a lot of interferences anteriorly. So maybe they have a crossbite. Maybe when they occlude, they have a canine that is touching, that is creating open space elsewhere in their mouth. They're not able to feel that stability and relaxation. So we need to remove that interference. And that's where we'll build a splint that is, or the dentist will, that's where I'll ask for a dentist to build this splint that gives the molar premolar contact, but has a lingual bar to help open up and free up that interference that is creating all of that tension in their system. It's like, imagine walking around on your toes and never allowing your heels to touch, how much tension your calves will have. And that tension will go up into your pelvic floor. It'll go up into your chest. It won't allow you to access your diaphragm, and you're going to be stuck breathing with your neck. And so those molars, just like the heels, give you the ability to rest, stabilize, and then move forward.
Oh, this is a beautiful explanation. I actually have a friend who has inflammation of sesamoid bones in the foot. But I think it's going exactly from you described. And too much pressure. And everybody who offering the treatment to her, they don't offer treatment with the splint. They focus exactly on the foot. They even focus on the hips. You know, obviously it goes to the hip, but no one offer her to have a splint to feel grounded, to relieve that inflammation on sesamoid bones, because it's too far. You know, how
information, it's not out there. You know, we don't get it in school. You know, how many days of TMJ training did you have in dental school? A day or
not
two?
Much. And
I didn't have one day and maybe half a day in PT school. We just,
course.
the information is not out there. This is not known to the public, which is why
Oh,
it's so great that you have this podcast, that you're introducing this information so that more people start to ask questions and start to know
absolutely.
who's looking at this. Yeah.
No, that's so important. I don't know, I didn't, number one, it's still, I do this treatment, as you know, I help, I've worked with a physical therapist, and I would be very, very honored to work with you to offer, my help to people who suffer from that, forward, tiptoeing position, whatever. But because it's such a revelation to me when I put the guard in the mouth and patient said, I feel very different. I feel the earth under my heels. And it happened already many times. But every time it happened, I'm still in wow. Like it seems like, I always call my staff and I said, can you repeat again? Like
Right.
maybe it's not true. But I
Well,
never
you want to limit your bias, but it's autonomic, and I see it every single day in practice. And dentists, you guys have such an incredible impact on the health of the body, and there's so many dentists that are doing great things that don't even realize they're impacting the entire body. It's really amazing. And so
yeah. No,
just
thank
bringing
you.
that awareness about is really important.
Thank you. But I want to ask you, for dentists who are listening to us, or hygienists, or even myofunctional therapists who would love to work with a physical therapist, tell me, like, how this collaboration should start. What should happen for these two specialties making that click?
Yeah. So I think a big part of it is just look in your community. It's really important that you look around. If you're a dentist, look for physical therapists, even if you have to go door to door, and start asking questions. What is your understanding of posture? Do you see patients that have jaw pain? What are you doing with them? Come into my office, watch how I work. These are the splints that I'm using for a patient that comes in with jaw pain. It starts with relationships, and it starts with a conversation. And if you're open to seeing what other people are doing, it takes time to build a team, but it is so worthwhile using that time and talking to others, whether it's listening to podcasts, going onto Facebook. There's so many groups out there, and a lot of them are patients that are looking for us. And
True.
so the more you can pay attention to some of these conversations and see who they've used, who they like, start looking those people up. If they're within, 45 minutes of your office, they're a potential person that you can collaborate with.
But not all the physical therapists treat temporomandibular joint like you do. I interview a lot of physical therapists in my community, and most of the treatment, even some very progressive people who I highly respect, they said, oh, treat TMJ with us. But most of the time, they do manipulations themselves. They show the exercise, they do manipulation. But percentage of people who knows about PRI and knows about MOOO or MMOO, very, very limited.
There's very few, but it's a growing knowledge base, and PRI is growing like crazy. And it's not the only way, certainly. I mean, there are success stories. The most important thing is addressing the posture, the upper cervical spine with the occipital bone. And so when we look at the design, this is the back of the head, this is C1, and this is C2. These three bones need to be vertically and horizontally aligned. And if they're not, then we get a rotation, and all of a sudden, if we look from the front, here's the front of the maxilla, the occlusal plane is going to be off. And so when that maxilla is tilted because the upper cervical spine is not aligned properly, well, now your jaw has to move to try to match that. And all of a sudden, you've got one TM joint that is in a class 2 position back, and that other side rotating and coming forward. So now you're going to have increased compression on one side of the joint, early contact, and then the opposite side is trying to work hard to get that same contact. So now you've got masseter and temporalis overactivity trying to equalize that pressure. And over time, that's one of the main things that ends up driving inflammatory conditions, temporomandibular joint breakdown. And so if we're not managing the cervical spine properly with the cranium, then you're building a splint off of someone that is not in a neutral position. And so when we talk about collaboration, the ability to have a physical therapist that you know has the ability to get the cranium and upper cervical spine aligned, and then they need to come right to the dentist for impressions, because you want to take your splint impression with them neutral, which means when you're taking impressions, make sure that their head is not rotated. Make sure it's not extended. You want their head neutral before you take your bite, because that splint that you're making off of that bite, when you equilibrate it, you're equilibrating it to the position that they are currently in at that moment. And you want to support them in the best neutral position as possible. And that splint will help hold them and stabilize them in that healthy neutral position.
That sounds like a poetry. You know, I really love how you're talking. Like, it's not so easy to do in a technical way, but I think collaboration would be the key. Because if you're able to coordinate with the physical therapist, what they align the patient, and then you align it with the splint, and you know, when you're equilibrating, you know, hopefully physical therapists can align them before the equilibration. Because yes, taking bite is very important, but I find it, you know, at least in my hands, I never able to get it so precise from the lab. So equilibration take a lot of efforts. A lot of efforts anyway. So most important, I think, alignment before equilibration. That would be from
that'll
my...
make your job easier for sure. When you come to equilibrate, there'll be less equilibration, the better they're aligned when you take that impression.
Yes, and before equilibration, I think, as well. So that's very important. So my last question to you: how physical therapists can help dentists who are passionate about helping people sleep well? I'm talking about mandibular advancement devices, myofunctional therapists, how that can be done with a physical therapist, or what's important for physical therapists.
Yeah, I got to bring up a quote from Mariano Roccabato, who is really kind of the godfather of collaboration between dentists and physical therapy. He's a Chilean physical therapist that is a professor of dentistry in Chile. And he always talks about it being a 50-50 collaboration, whereas the dentists are really doing this 50%, and the physical therapists are doing this 50%, right?
Mm-hmm.
So we've got to manage the cervical spine as well as managing what's happening with the occlusion. And
Mm-hmm.
so when it comes to managing sleep, the daytime is the job of the physical therapist. Eliminate parafunction, eliminate bad habits. So one of the first things I teach any patient, whether they're an airway patient or not, is proper oral resting posture. Teeth should never remain in contact. Tongue should be resting at the roof of the mouth. I talk about it like an umbrella. The tongue should open up and rest on the roof of the mouth to support the top of the head. It's like a pillar holding up the head, and the lips should be lightly contacted. Breathing in and out through the nose when at rest, and the nostrils, when we breathe in, should flare. If they start to close, that's an anterior nasal valve collapse, which is going to create increased airway resistance. And that's where we need to start thinking about exercises to dilate the nose, maybe even using a nasal dilator for sleep, like a MOOO. There you go. Beautiful. Perfect. Intake air is great if they can't tolerate something in the nose. So there's tremendous products out there that can be helpful based on what that patient's needs are. At nighttime, it's really about how the dentist can help maintain an open airway, making sure that the jaw is well aligned. Posturally, good positioning is really important. A good pillow supporting the head and neck, and then making the decision of, is it just vertical that they need, or do they need some advancement because they are so retrognathic? Remember, the tongue is attached to the jaw. If the jaw falls back because of gravity, so if you're sleeping on your back, the tongue is going to go back with it, potentially occluding the airway or certainly increasing airway resistance. And so there are situations where a mandibular advancement device can be incredibly valuable to help maintain an open airway. From a physical therapy standpoint, if a patient is wearing an MAD, we want to make sure that the neck is free so it can get into a good neutral position, because if the jaw is being pulled forward, but it's also drawn the head posteriorly, then you can get a lot of compression in through the back of the neck, which can cause an occipital neuralgia. So there's little nerves that pop out here. And if the head is rotated posteriorly, you're closing off space here, potentially pinching those nerves. And so if someone wakes up in the morning and they have headaches, there's a good chance that they're sleeping with a forward head, posteriorly rotated cranium. So head positioning, body positioning when we're sleeping is crucial for an open airway, good quality night's sleep, and the ability to wake up without a headache.
Thank you very much, Vlad. And I want to mention to our audience, Dr. Gilden has 3 office locations in New York, in Manhattan, in Connecticut, and we're going to put links underneath this interview, and in Aspen, Colorado. But in addition to actual physical therapy offices, he has also educational, virtual facility called LIV, and you can take courses exactly about topics we discuss. And, of course, he has a website, and I learn a lot about different strategies, what his practice offering to relieve the pain and make a better, balanced body. And if you're a dental professional, I highly recommend you to become familiar with his courses, and even that strategy. What struck me on a lecture when Brett talked about dome procedure, MARPI procedure, what those revolutionary procedures have to be done together with the physical therapist, because head is actually attached to the body, and it's very important for success of those treatment courses to have body in balance. So thank you very much for sharing your knowledge. I appreciate that so much.
This was fun. Thank you so much. Can I say one last thing on just if you're thinking about if you're performing any kind of expansion procedure, whether it's minimally surgical procedure like a dome, or MARPI procedure, or even doing just a bone-based expansion, DNA or something along those lines, you're going to have better success if you're minimizing some of those craniofacial asymmetries. And so when the spine is not aligned, you're going to have asymmetrical forces creating these asymmetries. And so seeing a physical therapist first to work through some of the soft tissue, joint, and neural tension structures is going to allow for an easier expansion with less discomfort on the patient's side and less asymmetry, which is ultimately, what everybody wants.
Final goal. Yeah.
This was such a pleasure. This was fun. This time went so quickly. And I really appreciate you asking me to be on this.